Hi everybody, Dr. Julie McLaughlin here from McLaughlin Care, and it's Functional Medicine Friday. So this week, what we're going to be talking about is gambling with your health. We want you to be able to know what risks are possible that are coming your way that we could predict and, more importantly, prevent. Now, some of you may already have some of these risk factors and conditions that have already started to show up in your lifetime, and we want to try to correct those as well. So remember, our goal is to prevent, predict, and correct any of these chronic issues. That we always look at labs. We look at a really comprehensive panel with the labs, which looks at our physiology. But there's more to us than just our physiology, because the labs are great, but we also need to know some other numbers. When we look at risk assessments, a traditional risk assessment is called the Framingham Risk Assessment. And we want to improve upon that with looking at a bunch of other things. In our practice, that we do a big variety of assessments on our patients. So we, of course, look at gender, age, smoking, and blood pressure. Those are the typical things that you see in the Framingham risk study. But we also look at BMI, percent body fat, subluxations, immobilities in the spine, how you move. Do you have an inflexibility? Your waist to hip ratio, if you're having anterior head posture. We look at your strength and your waist measurement, as well as the McLaughlin Risk Health Assessment. And many of you who are my patients have had this risk assessment done when they first came in. But what we're going to do today is we're going to go through each and every question over the next 4 weeks of Functional Medicine Friday to take a little deeper dive on each one. So there's 20 questions total in the risk assessment, and each Functional Medicine Friday, we're going to go through 5 and a little deep dive. So if you want to take the risk assessment on our website in full, or you want to have somebody in your family take it, I'll put a link in the bottom of the video in the description box. So let's start with the first one. Do you have a family history of early cardiovascular disease? So what that means, if you have a male relative that's had any kind of cardiovascular disease before the age of 55, or a female relative that's had a cardiovascular disease before the age of 65, this would be a risk factor for you. Now, when I talk about cardiovascular disease, that means heart attack, stroke, super high cholesterol, any of those type of things are going to be a huge risk. So if you don't have anybody in your family that's had this, then you're not going to have this risk. But if you have a family member with later onset heart disease, you're going to have a risk. If you have just one side of your family, you're going to have a risk. And if you have it on both sides of your family, you're going to have a double risk. And if you have it in multiple generations, that's the highest risk of all. Out of all our risk factors, this is the biggest risk factor. To have someone have early onset heart disease, cardiovascular disease, and if someone dies early, so if you have someone in your family who died from heart disease, maybe a heart attack before 55 for a male or before 65 for a female, that doubles the risk of cardiovascular disease in you. And if someone in your family had that event occur before the age of 35, it's 10 times the risk. So this is something we want to be aware of, because heart disease then will be always on our bucket list to make sure we're monitoring to see where you are and predict it and prevent it. And there's a lot of things we can do naturally with lifestyle and nutrients to help control this. But the most important thing is knowing about it. So our number 2 risk factor is, do you have bleeding gums or gum disease? You think, what the heck? What kind of risk factor is that? I thought only dentists talked about that. But if you do, if you have bleeding gums or gum disease, and you never floss your teeth and your gums bleed or hurt, or your teeth are sensitive, that doubles or triples your risk of a heart attack or stroke. So bleeding gums and gum disease is a direct link with heart disease. So if you or someone in your family has this, again, we want to look at those labs. We want to be able to predict Why are you having these bleeding gums? And what is it doing to your cardiovascular system? What about sleep? We know a lot of people have trouble with sleep, and sleep is super important. It is one of our foundational needs as human beings. But if you're sleeping 7 to 8 hours a night, you're good to go. If you sleep but you're restless for 6 to 8 hours, you're okay, but not as good, obviously. If you're sleeping less than 7 or more than 9, then we got an issue. If you're sleeping less than 5 and have poor quality, or less than 4, even if it's good quality, all of those are risk factors. And they are 4 times increased risk for diabetes and obesity if you're sleeping less than 7 hours a night. There's also an increased risk if you're sleeping more than 9 hours a night. So you want, in that sweet spot between 7 and 8 hours a night, if you want to lose weight while you sleep, if you will, and decrease your risk for diabetes. Now, the next one is, it goes with sleep, do you snore? So if you're not sleeping those 7 to 8 hours a night and you snore, you're going to have a double whammy. If you don't snore, you're good on this. But maybe your husband or your wife snores like a buffalo and you didn't know this. But this is one of the highest risks for cardiovascular disease and hypertension or high blood pressure. So snoring causes more of a risk of cardiovascular disease than smoking or obesity. Isn't that unbelievable? Snoring is worse than being overweight and smoking. So any kind of snoring, I want you to make sure you're getting checked, get a sleep study done to make sure you're not having sleep apnea. If someone in your family has sleep apnea, I want you to get this checked, because sleep apnea not only can be caused by weight gain or just obstruction, but the shape of your face and the shape of your throat that you were genetically born with can attribute to sleep apnea in many people. So we want to know, do other people in your family have this issue as well? And the 5th question we're going to talk about today is, does anyone or you have autoimmune diseases? So autoimmune diseases are diseases where our body attacks our own immune system. So do you have rheumatoid arthritis or celiac disease or a thyroid condition called Hashimoto's or psoriasis or lupus or any other inflammatory or autoimmune disease? So if you do, even if you're taking medication to control it, it still increases your risk of heart disease by 40%. So we want to be that much more vigilant on checking your blood, looking and seeing what we can predict and what we can prevent. The symptoms sometimes can be debilitating on these diseases, even in people who are taking medication. Now, if you don't have the disease yourself, but someone in your family does, this risk still applies to you. So those are the 5 questions for today. So I want you to know we put those questions along with your blood work, because that's going to tell us what it is in your history risk and what it is in your physiology risk. How do we change those risks? Eat better, move better, think better, and sleep better. And we pick each one apart and make a personalized plan for you. In our office, we do the risk assessment. We do your blood pressure. We look at your body composition and your posture. We look at core flexibility and core strength, as well as a blood test. And that gives us a really good picture of where you are now and where we want to go with your health in the future. That's it for Functional Medicine Friday. I will see you next week.